This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Welcome to BAF Insurance as we get together each and every Wednesday morning at 6:30 a.m. until 7:30 a.m. talking about all things related to your health. And we have some friends with us here from Total Health. I'll let them introduce yourselves. Good morning, ladies.
Hi, good morning. I'm Dr. Priyanka from Total Health. I'm an ophthalmologist working there from last 3 years. So I just want to today make you aware about some important eye diseases.
Okay.
Yes,
and also?
Just as good morning. This is Viviana Gomez from Total Health. I'm a health and wellness liaison, and I've been working for Total Health the past 2 months, and 2 years, sorry, and I'm very excited to be here today with you guys.
Excellent. So, Dr. Priyanka, what exactly do you do? Because it's a big title. I know it deals with eyes, and tell me a little bit more about that so our listening public can understand.
So basically, if you will consider as a one organ, that is eye, which is pretty much small, but the diseases and problems are very vast compared to the size of eyes. Okay, and it's very vital organ. If your eyes are okay, everything is going to be okay. If your vision is okay, your life is going to be okay. So since eye is a very important organ, so we actually deal with everything from your vision perspective, your diseases related inside your eyes, and a lot of allergic eye diseases and pediatric vision assessment, and like a lot of community eye related problem like cataract, glaucoma. So we need to include all the disease prospect of the eye, which can give you a healthy vision, and it will help you in getting your healthy lifestyle.
Exactly. So basically, when you think of it, the eye that you're looking at deals from young to complete elderly folks, because growing up, a lot of kids, eye infections, we call it pink eye, things of that nature. And then as you get older, you have glaucoma, you have vision problems. So you really need to take care of your eye from start to finish.
Yeah. Basically, eye checkup should be started from, once child is born. A basic eye screening is done by a pediatrician. Once the child is little older, like maybe 1 year, they should, if the pediatrician would find that there is any problem or anything, they will refer the child to us. Then we will do a screening for their eyes when they are 1 year old.
Okay.
But ideal, regarding the vision assessment, if pediatrician find everything is okay, usually the first eye screening is considered at the age of 3 years or 4 years. When the children started to learn alphabets, then we can assess their vision more accurately. And that time we do all eye examination, including like their retina checkup and their vision assessment, color vision, and everything, which will help for their growth development, their social development, and all. And after that, you need if everything is going good, you can take an eye examination every 2 years. And if you have any problem, then you can take every once in a year, you can check your eyes with starting from the beginning to elderly. But the most important thing, pediatric eye screening, is very important in terms of one thing, that when the any child is younger, their eyes are in a developing phase. So suppose if they are not seeing correctly and they have not been checked for that, their vision is going to be diminished permanently if they have not been given glasses at right time. Okay, because that is a vision developing age. If the eye will not see correctly at that time, if you are going to correct it at later on, there will be no effect. They are going to be blind for lifetime.
Okay.
So that is called, there is a term in medical terminology that is called lazy eye. because your eyes has not been used properly, because your eye was not seeing correctly and you have not been given glasses, so their vision will be permanently diminished, and that is called lazy eye, because you have not used that eye for long time. So this is a very important message to community, that for pediatric patient you have to do a regular eye screening, so that we can detect if they have any refractive error in one eyes, because if they have vision problem in both eyes, that is easily detected. Either child will complain, or a parent will notice that child is going very close to TV while watching TV, so that will be detected. But sometimes what happens, your one eye vision is okay but other eye is poor. So what happens, since you use both eyes for seeing, so you couldn't detect problem in one eye. So then when they come for eye screening, we check their eyes, and when we found that their one eye is not okay and it is corrected, and then we give proper glasses so that their both eyes should work very fine till lifetime. And if it is ignored, their one eye is going to be lazy eye, and it will lose their vision for lifetime. So that is, pediatric eye screening is very, very important in that sense.
And I always thought that when a child had eye problems, it was mostly double. But what you're saying is it's easier to detect when it's double, and it's harder to detect when it's just one left or right eye, because it takes longer for you to see that there's a problem.
They compensate with the other eye.
Definitely. When you have, even for like ourselves, if I have one problem, that would be compensated by a normal eye. So it will be very hard to detect unless you close your normal eye. Then you see, I can't see from this side. So most of the time, unilateral problem is always ignored and it's not detected. And regular screening, if they are encouraged to have a pediatric eye screening, these problems can be detected early and can be cured accordingly. And we can bring their vision back.
Yeah, prevention.
Prevention. So you really see it as, when a child is younger, the earlier you can correct it, the better vision they can have growing up and continuing on. Because up to 10 years is the vision developing age. If somebody is not given glasses under 10, and if they will come after 10, even if we will find they need glasses, and we will give glasses, but we can't bring their vision back. So that's a
time
big challenge.
sensitive.
So
it
that
seems
is
like it's time sensitive.
Right time intervention is very important. So doing that intervention, you have to bring the child to the eye provider at right time.
Exactly.
So that is very crucial phase of their life.
Exactly. I mean, we always hear about the criticalness of time sensitive when it comes to eye protection. Especially with young kids, at the developing age, bright lights and closeness and proximity. Growing up, they said, don't let you watch TV too close because the screens are so bright. Now, the screens are the size of the wall. so you don't need to sit close to watch. So does it get harder to detect? So you really need to stick to the screening times that your pediatric or a pediatrician would advise to do eye checkups.
Definitely. Actually, nowadays, the screen time and the gadgets, this is not a problem only for pediatric population. It is problem for all ages. And that term is called digital eye strain. There is a medical terminology that is called digital eye strain. Digital eye strain is the eye strain which is related with excessive use of either computer, desktop, iPad, phone. So basically, if you will talk in terms of pediatric population, most of the cases, first time parent notice that child is going closer to watch TV, so they bring their child to the healthcare provider or eye care provider. But sometimes the child is sent back to us by pediatrician or by regular school screening program. They find their vision is not okay, then they bring the child to us. But the one thing that what happens nowadays, most of the children are actually, we encourage them to watch TV or any gadgets from far distance. Not now they want more to watch iPad because that is totally under their control. They can change everything very fast.
It's more interactive with the iPad.
So basically, we encourage the child to use their distance vision more than near vision, because this is again a developing vision developing phase. More they will see far, more their vision will develop. If they are not using their far vision and their world is limited to the iPad and phone, then their far vision will not develop and they will be like nearsightedness.
Okay.
So this is a most common cause for nearsightedness. Nowadays, you will see a smaller kids, they are using glasses. Like it's kind of epidemic. Everybody is like 3 years, 2-year child is having glasses. That never used to be happen in the past time.
Because they never.
Yeah, because now their world is restricted to the very near thing. You know,
So you think
They
it's
are-
because of the iPad use?
yeah,
or
now they are
screen.
not playing too much time because of many reasons, like because they are like they feel more comfortable doing games in the computer and lot of things.
So, Doc, I mean, this is a kind of a personal question. Based on the development of the eye, I've watched, this is while traveling, kids as young as 18 months, 2 years with phones and they're watching stuff on the screens. What age would you say would be appropriate for someone to start watching, a child to start watching on an iPad or screen? You know, being productively looking at it.
Ideally, there is not any study regarding a certain age that they should allow to watch, but definitely no phone should be given before 3 or 4 years.
Okay.
Phone should never be given, and intermittently you can like start giving them like watching TV, some educational program after 4 years. Okay. But even if you are like starting it early, just you have to limit the screen time, like half an hour. It should not be like they are sitting for long hours on computer
2
or TV.
and 3 hours.
Yeah.
No.
Yeah, means like half an hour or 15 minutes is going to be okay.
It's been
Okay.
proven that it affects
So
the
time
attention
factor is
span.
very important, because and the problem again with like when they are spending too much time on like these gadgets, another problem that is going to happen with everybody, not with only with the pediatric population. When they are watching phone or they are playing game, they blink less. Means automatically when we are focused, our blinking become less frequent. So what happens that precipitates dry eyes.
Okay.
Blinking is very important to maintain
The moisture in the eye.
moisture of your eyes. So nowadays, younger kids comes with the dry eye problem. Like they feel like irritated, watering of the eyes. So the continuous watching on any gadget will cause you like dryness thing as well.
Okay.
So that will again affect your eye health. So somehow it is never recommended to spend long time on these things.
A long times.
Yeah, but nowadays, since your education is also given on your iPad, even the school has lot of everything they are doing with the iPad. So only we can do is like we can limit their screen time.
Yeah.
Like
Okay.
whenever they need it, they just do it. Don't do it for your like playing games for a long time. And even if they are doing, try to like blink as often as possible and take adequate break. Like there is a term called computer vision syndrome. Like this is again for all the population. Those who spend a lot of time on computer or iPad, they have to follow 20-20 rule. Like every 20 minutes, they need to look 20 feet apart for 20 seconds. This is the way to give break your eyes from the
from watching
screen,
the
and
screens.
so that you can
Wow.
blink and you can use your far distance.
Folks, we're going to take our first break. We're talking to the ladies here from Total Health. Once again, introduce yourself to my public.
Yeah, so I'm Dr. Priyanka and I'm an ophthalmologist from Total Health, and I'm looking care of your eyes for your healthy vision.
Okay.
And this is Viviana Gomez from Total Health, and I'm Wellness and Health Liaison.
So we're going to take a quick break, come back. We're going to talk to Ms. Gomez. And also, I want to ask them about adults now. We've talked quite an extensive bit about our younger kids and the care of that. Let's talk about adult eyes, because when you think about it, we watch TV, we watch our phone, we watch computer screens. We're going to talk about that coming back in just a few minutes. Thank you so much for tuning in.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about sciatica and back pain.
Millions of people worldwide suffer daily with debilitating back pain, in particular, lower back pain. I know, I'm one of them. Like all pain, back pain is a symptom of a larger medical problem. Your back is a complex system of muscles, ligaments, nerves, and bones. An injury to any of these components can impact your entire back. Back pain can also be a symptom of kidney disease. But for now, let's take a look at sciatica, a common problem that begins in the lower spine and causes major pain and discomfort. Your spine is made up of bones called vertebrae that are separated by flat, round disc housing connective tissue, which sits protected within the vertebrae. However, when the discs become worn because of injury or aging, and the soft connective tissue begins to bulge beyond the disc, then you have what is called a herniated disc. Herniated disc can cause severe back pain because it puts pressure on surrounding nerves, including your sciatic nerve. The longest nerve in your body, your sciatic nerve, starts in your lower back, then splits to run through your hips, your buttocks, legs, and feet on both sides of your body. This explains why sciatica can cause severe radiating pain down your legs, as well as numbness, tingling, weakness. Anything that puts extra pressure on your spine can put you at a greater risk for sciatica. This includes being overweight, frequent heavy lifting, sitting for too long, whether for work or leisure, and as mentioned before, damaged discs. For many people, over-the-counter painkillers and anti-inflammatories like ibuprofen or naproxen, lidocaine pain patches, or alternating hot and cold packs on your back for a few days will help relieve pain in the short term. But if these do not work, then you may want to discuss a long-term solution with your doctor. Alternative medical interventions, such as provided by a licensed chiropractor, acupuncturist, or massage therapist, may be able to provide significant long-term relief, and a physical therapist can teach you stretching exercises that release the pressure on your nerves. But for some people, surgery is needed. Only you and your medical practitioner can make that decision. Back pain can stop you in your tracks, but with medical help and a commitment to finding the right solution that works for you, you don't have to stop living.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance, plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
I'm free to live my life, yeah. Free to be me, yeah. The way I wanna be, doing the things that I wanna do. 'Cause I'm living my life, hey, BAF for life. Yes, I'm living my life, hey, BAF for life. For life, BAF has got you covered.
Thank you so much for tuning in to Your Health, Your Wealth. This is a BAF Insurance. This is a community initiative from our friends over there at BAF. Each and every Wednesday at 6:30 a.m. we get together and talk about all things related to your health right here in the Cayman Islands. And I have with us friends from Total Health over here. We're talking about eye care and also for youngsters, youth, I want to say teenagers up to adults. And so I asked this question before, and I'm asked the doctor about it. When we take a look from adult side, we're on our computers because everything now is computers. We're on that 7-8 hours a day. Then we go home. We have our phone with us. We're on that another 5 or 6 hours. Then we're watching TV for another 3 hours. And then even 8 hours of sleep. We rest the eyes, but the first thing we do before we get up out of bed is we look at our screens on our phones. Sometimes it may be blurry because we haven't even woken up yet. Tell us the ramifications of that to our eyes.
So basically, again, for adult population, which is again not restricted to adult population, for all age population, like they are totally dependent on gadgets, either work related, either entertainment related, either shopping. Everything is like with your phone or computer screen. So I have already mentioned there is a term that is called digital eye strain. So nowadays, everybody who is like, especially those whose job, they are working from 8 to 5 on computer, and there are no any escape from doing computer work. So they like, in the beginning, it's okay. But when they are doing it like for long time, they started having some issues in their eyes. Like at the end of day, they say, my eyes are quite tired. My eyes started getting watery, redness, sometimes headache. So for them, I would like to give two advice. One is like, first, whenever you had any eye symptom, when you are working long hour on computer, you again need to do an eye checkup. First, we have to rule out your vision should be okay. You are not straining your eyes because of uncorrected refractive error, or whether if you need glasses, you should have a proper, prescribed glasses. To make yourself comfortable for every distance, either you're working closer or far. So your glasses prescription should be updated. Your eyes health should be okay, like your retina should be healthy. And the second thing that I would advise, which is like, again, it is called digital eye strain, which is like when you're working on computer for a long time, it make your eyes dry. So there are two muscles. Since you are working on closer distance, you are using your near muscles. So what happens when you're working from morning to evening, your near muscle get fatigued, and it will give you like headache or pain around your eyes. So to relieve that, what you need to do is, again, the already mentioned, it is called 20-20 rule. You have to look 20 feet apart for 20 seconds in every 20 minutes. So this is a way to relax near muscles. When you're looking far, those near muscles are getting relaxation. So in long term, it will help you to relieve the eye strain symptom. Second is frequent blinking. Like when you're working on computer, you forgot to blink because you're focused on your words or your lines or whatever you're doing.
You're going to miss something.
Yeah, you don't want to miss. So you have to change this habit. You have to blink voluntarily, like as often as you can do. Because when you blink, the tear film which is in your eyes, it spreads all over your eyes and make your cornea, wet, and you don't feel dry eye symptom. So if you will follow these two advice, even if you are working long hour, you are not going to have any eye related symptom. You feel better because you can't you can't avoid your work, but you can change your lifestyle.
Right.
Okay, so you have to follow these instruction, and obviously taking healthy food will always help to enhance your healthy vision, like vitamin A rich food like carrot, mango, fish. These are the healthy food which help to enhance your vision and your eye health. Okay. So you have to add those things and do some eye exercise in the morning, like rotating eyeball. These kind of thing will definitely help to relieve your symptom, which comes with the computer or screen.
I think we forget that we use our eyes all the time. It's so normal for us to do it that we forget that we need to take and exercise them in the proper way also. Because, as you're talking to me, I think to myself, man, I come in at 4 a.m. and my eyes are on that computer screen till I leave. And then I say, there have been days that I said, you know what, I'm going to stop. I'll go outside, sit down in the waiting room, close my eyes and just relax it for a little bit. And I come back and I feel more refreshed. I need to do that more often because that is eye care health. I don't think about it, but now that you're mentioning it, I'm like, okay.
Yeah, definitely. Basically, my purpose of saying is that you can't avoid work, but you can avoid other thing which is avoidable, like your social media, Facebook and Instagram. You don't need to spend too much time on those things.
Right.
So better to focus on your work, which is mandatory. Rest of the times, try to avoid the screen as much as possible. I know it's very easy to say and tough to do,
Yes.
but definitely,
It's addicting.
if you will
Yeah.
inculcate these habits, you are going to have a very good vision, and you will not have those eye symptoms. Because what happens at the end of day, ultimately, there will be a time then your eyes will give up. And you, even if you want to see phone, you so no, I don't want to see. My head
my
is hurting.
head is throbbing.
Yeah,
my
I just want
eyes.
to sleep. So
Right.
don't bring that stage in your life. You have to take precaution before that.
Exactly. I think that is a great point for us to take a break. We're going to take our second break, and when I come back, we're going to talk to Miss Vivian about all the things that our friends over there at Total Health offer in their establishment, because it is a long list and some great services I want to get into. We'll take 2 minutes and come right back. You're listening to BAF, Your Health, Your Wealth.
The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, your priority.
Your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about
There is so much information on what happens to women as they age. Menopause, weight gain, thinning hair, and on and on. But what about the men? Today, I'm giving the men some attention and taking a look at common health conditions that may occur in men as they age. Many men see signs of aging starting as early as in their 30s. Taking care of your heart is high on the list because although heart conditions are not exclusive to men, studies show that they begin earlier in men, perhaps because most men at that age group think they're too young to have these issues, so they rarely get checked. Remember, cholesterol is more likely to increase with age, and so is the stress of work and family. So keeping your heart healthy is priority number 1. Male infertility can also begin to be a concern in your 30s, as sperm quality and level can begin to decrease and decline in your mid to late 30s. Your body's ability to filter out old or damaged sperm also decreases, potentially creating genetic challenges for future children. Sperm banks, although not necessarily available in the islands, offer an opportunity to store viable sperm for later use. You may also notice that either you have begun losing muscle mass or it's getting harder to build and maintain your existing muscle mass. Bone density may also begin to decline. This is normal, but easily retarded by getting enough exercise, along with calcium and vitamin D in your diets to keep your bones and muscles strong. Eat lots of dark leafy greens, fatty fish for vitamin D, plus vitamin C rich fruits, and if necessary, take a supplement that has these ingredients.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance, plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
BAF Insurance is reminding you to get regular exercise, eat lots of fruits and vegetables, avoid fried foods that are loaded with salt and saturated fats, and limit your alcohol intake for a healthier heart. A healthy heart is a happy heart. A message from BAF Insurance, providers of affordable, flexible, quality health plans to suit every need. Call 949-5089 or visit bafcayman.com.
On the line and in a pharmacy. How can I forget that? Which is a pivotal thing in our service, and it's everything under one roof. And I guess the main focus is definitely prevention, and just make sure that everyone has access to it as well. So come and visit us any moment.
For a long time, the options were limited in Cayman.
I'm sure.
And I think the idea that you can have everything under one roof makes it a lot easier for folks.
Yes.
So whether I'm with my grandma, myself, my wife, and my daughter, and my kids, I can come one place to say, okay, you know what, guys, we're going to spend some time here. We're going to get checked out. We're going to get this looked at. It's all under one location.
Absolutely.
I'm not driving from this one to that one. I'm not going to. It's all taken care of.
Very convenient.
Also, convenient. And I think that makes it very appealing to the community.
Absolutely.
You guys have been long standers within the community.
Yes.
And also, I like the pharmacy. The times that you guys are open and things of that nature makes it very convenient.
Yes, we're open from Monday through Saturday from 8 a.m. to 8 p.m. And soon I think it's coming to Sunday as well. So it's again open for service basically.
Right.
I forgot to add we have images. So X-rays and ultrasounds are also done in our clinic, and lab services, which is key too, because sometimes you don't have to, people wait for labs to be back from abroad, and we can have the results pretty much right away.
Exactly,
in-house.
and that's an awesome experience, because people, I've been into facilities and it's 2 weeks a week you got to do, and you guys are able to do everything in-house, which is, sometimes things are time sensitive.
Yes, absolutely. And we're very glad to be able to do it, and we're growing. And I think that's, for the Cayman community, is good that they know, and the access is right there.
So tell them where you're located at and how to reach out to you.
Absolutely. So we are located in the Grand Pavilion, and our phone number is 333-2222, or you can visit our website, it's totalhealth.ky, and very friendly user. You can book your appointment online, or simply give us a call and we'll schedule in.
I like that you're able to the world now has moved into that tech savvy mode, and it makes it easier to book everything online and be able to just get a response, head on in and get your services. And I like the confidentiality of that also. It makes it very, very unique and very personal. So kudos to you and your team for bringing that to the forefront, and also giving Cayman the opportunity to experience world-class healthcare right here in the CI.
Absolutely. Yes.
Thank you. So switching back, I wanted to talk to Doc about the elderly. As you get older, your body kind of deteriorates. We know that. But there are ways to keep up and also deal with things of glaucoma and things. I say that because that's probably one of the most common ones that is recognized here in the Caribbean, also for the elderly. So let's have a conversation about that, Doc.
Yeah, so basically, I just want to emphasize on this problem, glaucoma, which is right now the largest cause for preventable blindness in worldwide, including the Caribbean. So the awareness of glaucoma is very important for the public, because glaucoma is actually a disease of optic nerve. Optic nerve is a nerve which connects eyes to the brain. It gives signal. Whatever you are seeing, these signals are sent by optic nerve to the brain. So if anything happens to the optic nerve, you can't see. Your vision is going to affect it. So what happens, basically, glaucoma is a condition of optic nerve, in which your optic nerve is affected because of many causes, but most common cause is increased eye pressure, and it will eventually takes your vision, and it can ended up in blindness. So why the glaucoma awareness is important? Because glaucoma is a condition in which 90% patient is having no symptoms.
Really?
So that is like, it's called silent thief of vision, because it silently takes your vision, even you are not aware. So that's why I would like to emphasize on glaucoma, because usually what happens in glaucoma, you will not have any symptom and it will be detected by us only. So the question is, when you should be having suspicion of glaucoma, and who are the person who is more susceptible to have this disease. So basically the glaucoma is more common in elderly population who is more than 40. Okay, so
So sorry to interrupt you. So young, doc? I thought that it would have been an older age, but it can affect as young as 40?
Yeah. Means after 40, your chances of having glaucoma is more, and the chances will keep increasing as you grow older.
Wow.
Okay, so that's why after 40 you should have a regular eye screening. So basically in glaucoma, patient is not having any symptom. It is mostly detected by us by doing an eye examination. We check their eye pressure, we check their optic nerve. And if we find anything, like if your eye pressure is raised, then we do multiple tests like visual field test. Basically in glaucoma, what happens, your peripheral vision affects more. That is not easily detected by a person. So eventually it started with constriction of peripheral vision loss, and at the end your central vision will be affected. And by the time when you realize your vision is affected, it's too late to bring back your vision. So whatever part of optic nerve is already damaged, that cannot be bring it back to normal.
Wow.
So that's why if we can detect this disease little earlier, we can stop the progression, and we can stop the disease progression and stop the blindness. So those person who is more than 40, those who is having family history of glaucoma, those person who is taking steroid in any form like oral tablet or in nebulizer or any topical ointment, so they should be very vigilant about like glaucoma screening, or if they have any trauma. So those person or those who is very short-sightedness, high myopia is again a precipitating cause for glaucoma. So these persons should be very vigilant, and they should do annual eye screening regularly to check their eye pressure and rule out if they have any glaucoma or not, so that we can treat them at earlier stage and they should not landed up with the blindness.
Okay. So in reality, from the age of 40, folks, we should have a regular test. About how many years you think you should wait?
If you are not having any symptom, no family history or other precipitating cause that I have mentioned, you can take eye examination every 2 years.
Every 2 years.
But if you are have any precipitating factor, you should do regular eye screening once in a year.
Once in a year. Okay.
Yeah.
And for folks, say like me, who wear glasses, how often should we have our glasses tested or checked and things like that? I'm over 40, so
yeah. So personally, I would suggest you to come to me every year.
Every year,
yeah.
Okay.
To see me every year would be fine.
Just to be on the safe side, because based off of what you're saying is once the damage has occurred, there's no going back.
Yeah,
it's irreversible.
So it's not reversible.
Yes.
So it's treatable, but you can't fix the problem once you've reached a certain stage.
So that's why prevention is the only treatment. Mm-hmm. Because there is no treatment for, we can't we can't cure the disease. We can just stop the progression.
Right.
So earlier we detect, it's better.
Right, exactly. So over the age of 40, folks, we should constantly be vigilant of our eyes.
Yes.
And especially if you're in a high risk factor.
Yes.
If you
definitely.
had family who've had glaucoma.
Yes.
And for my listeners, always make sure I know it's kind of hard, but know your family history when it comes to the medical side of it.
Definitely.
It helps a lot.
It helps a lot because a lot of these stuff have fallen genetically and keeps going down. And you may, in the old days, they say, oh, well, so-and-so went blind because they were doing this, but there may have been a medical history there that we are not aware of.
Yeah.
So-and-so had poor vision as they got older. Well, there might have been a reason for that. And as we investigate, we can find out. And also help our generation with the information.
Definitely.
Exactly.
So basically, the only thing is whenever any disease comes with symptoms, it's easier to detect because they will come to us. But if it is asymptomatic, those things are mostly ignored. They don't know about their status. So only regular eye screening can help them to detect those problems. So that's why my emphasis is like, please do your eye screening regularly, even if you are not having any symptom. If you are having symptom, then definitely you're most welcome to meet me. But even if you are not having any symptom and you are having those risk factor, please don't ignore your eyes.
Exactly. We take it for granted. Oh, my eyesight is a little fuzzy, or I'm getting a little tingling sensation. Oh, I'm overusing it. Repetitiveness is a problem.
Yeah.
Underestimate the
And
symptoms
again,
that you don't know.
Diabetes is again a risk factor for glaucoma. Like if you are having diabetes, you are more prone to have glaucoma. So all the diabetic patients should also have their eyes checked up regularly, not only for glaucoma, but other condition that is called diabetic retinopathy. That takes your vision, your retina is involved because of uncontrolled blood sugar. So you should be quite vigilant about your eyes if you have any systemic illness, and even if you are getting older, you should be vigilant.
Excellent, Doc. Thank you so much for talking with us. We're going to start wrapping up here. We're going to take a quick break and come right back, and I'll just get some more information as we talk to Ms. Vivian about all the services that they offer over there at Total Health. You're listening to BAF, Your Health, Your Wealth.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K helps us prepare for hurricanes with our health in mind.
We all look forward to summer. Here in the tropics, that means more beach days, pool parties, family trips, and sadly, hurricane season. Now, we all have painful memories of hurricanes, but preparing for hurricanes is just a part of our routine. Making sure we have adequate supplies of non-perishable food, paper goods, and water stored is just a part of the drill. But there should be more to your hurricane preparations. The health-related items that are often forgotten until we sometimes need them. This hurricane season, don't get caught without critical supplies you may need to safeguard your health. Take inventory of your first aid supplies. Bandages, cotton swabs, antibiotic and antifungal creams, alcohol swabs, painkillers, and other first aid supplies can be very important in the aftermath of a hurricane. It is easy to get injured while you're shuttering your house before or you're trying to clean up after a storm. Broken glass from a shattered window or maybe loose debris can cause cuts and scrapes. And please remember, avoid standing water. There are many unseen dangers such as ringworm and other fungi, as well as a variety of bacteria that can lurk below murky waters. It's helpful to have your first aid supplies already on hand, so stock up before the storm. Be sure you have adequate supplies of your prescription drugs. You want to fill prescriptions when they're due, and then talk to your medical professional about your prescription drug supplies. You want to ensure that if a hurricane does threaten or hit, your health is not affected. Remember, power outages, flooded roads, and many other conditions may prevail after a storm. Stock up on healthy, non-perishable food items. Very often, the non-perishable food in our hurricane stocks are all canned meats and snacks that are loaded with salt and preservatives. Now, canned meats such as corned beef and canned soups are quick and easy to prepare during and after a storm because they can be eaten straight from the can or they need very minimal cooking. I understand. But these items have a large quantity of fat and salt, which are bad for your health.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
Welcome back to Your Health, Your Wealth. This is Chuck Taylor here with you as we continue on compliments of our friends over there at BAF Insurance. You can always reach out to BAF Insurance. Super easy to do. They're online right there. I'll give you the information in just a few moments. But in the meantime, we're here talking to our friends from Total Health. And they've kind of given us a broad view about how we should take care of our eyes. Very, very sensitive. One of the most underappreciated, because we think we use it all the time. We don't think there's an issue till when we wake up and we have blurry vision. We wake up and your eyes irritated, infection, different things like that. Doc, before we get out of here, I wanted to ask you, how can we maintain a healthy eye? Little tips that people can use, because we're out sun, we're out in dust, we're out. People. Now it's all about washing your hands. People put things in their eye. How can we maintain a healthy eye care regimen?
Healthy eye or healthy vision, you need to follow like few things. First is like healthy food. Avoid junk food. These are especially for kids, but nowadays adults are also following. Mm-hmm. It's easy to eat pizza. Mm-hmm. So avoid those junk food. Healthy food brings you healthy vision. Second thing is, whenever you are going outside, you should always use sunglasses, because the UV rays that are coming from sun, it's not good for your eyes. So always have sunglasses when you are outdoor. When you are working on computer, follow 20-20 rules. Take adequate break. You have to do the frequent blinking. For pediatric kids, they should play outdoor as much as possible. They should be away from the screen, and you have to be aware of other systemic condition in your eyes. Like you should take a regular health checkup to know if you have any underlying disease like diabetes, hypertension, or any other associated disease which will eventually affect your eyes as well. So you should know about your health condition as well, and definitely regular eye screening is very important.
Excellent. And Ms. Vivian, if anyone wants to get in contact with you over there at Total Health, want to book appointment, how can they go about that?
Absolutely. Again, they can call directly to our phone number, which is 333-2222, or they can go on our website, which is totalhealth.ky for a second. www.totalhealth.
So what you do, just re-say that then. They can go to our website.
They can go to straight to our website, and it is www.totalhealth.ky.
Excellent. And some of the services that you guys offer over there, I know it's a complete. Just give them a quick rundown.
Absolutely. We have images, meaning ultrasound and x-rays done on site, laboratory, ophthalmology, dental, internal, pediatrician, physical therapy, and also IV infusions. So it's a big gamma of services, and we're growing. So
of course. And you're located right here in downtown George.
Grand Pavilion.
Let me read it. And you're located right here in Georgetown.
In the Grand Pavilion, the Grand Pavilion building. So
right, easy access. Easy to get to, and also you can check them out for all their services. Ladies, thank you so much for stopping by here today.
Thank you for having us. Thank you so much.
Thank you so much.
I'm free to live my life, yeah. Free to be me, yeah. The way I wanna be, doing the things that I wanna